My name is Carol Pizzo. I'm the technical lead for the Behavioral Health Community Partner Care Management Program called the Behavioral Health Partners of Metro West, LLC. We fondly refer to the program as the BHPMW. In this role, I led the process around decision-making relative to technology and software vendor selection. I am also responsible for the project management and creating operational systems that facilitate collaboration between our LLC, the software vendor, and others using the platform. I will discuss the vendor selection process, project management, and governance structure during the video. The first major decision to be made was related to what type of software platform was needed to support the program. I began reviewing the structure of electronic health records, but it quickly became apparent that this type of software was not a good fit. Electronic health records are document-based systems siloed by services. The BHPMW needed workflow support, population health management tools, and a holistic view of our members. This led me to begin researching care management software. Shortly after starting the research, I encountered two obstacles. This segment of the software industry seemed to be less developed than the EHR world. There were also many vendors whose capabilities differed significantly from each other. The second obstacle related to the very Massachusetts-specific needs of this program. To manage this, I decided to tease out the contractual requirements and create a vendor evaluation grid. When the grid was completed, there were 256 high-level requirements. We initially evaluated 58 care management software vendors through a series of phone screenings. 30 of the 58 passed the phone screening and received the detailed requirement list for sign-off. Many of the 30 vendors took themselves out of the running shortly after receiving the requirements. Between our evaluation of requirement responses and vendor attrition, my team and I were left with 15 vendors to assess. We had the 15 vendors do detailed demonstrations, and through this process were able to reduce the number to 6. At this point, I believed it was important to update our partners in the LLC and start involving them in the decision-making process. I encouraged our partners to bring full representation from their organizations, including IT, EHR, and operational stakeholders. After discussing the merits of being on a care management platform rather than an EHR, we had to make the important decision about being on one platform. Shortly following that decision, my team and I began the evaluation process of the final 6 vendors. This process involved a full demonstration to key partner stakeholders, during which all in attendance ranked each vendor on 15 categories deemed important to the BHPMW. Categories included referral management, workflow support, population health management, and project readiness. Each category was ranked on a scale of 1 to 10. This ranking provided us with the data to once again reduce the number of qualified vendors to 3. The 3 vendors provided a final demonstration, and the partners in the LLC voted on the final vendor. I believe transparent and predictable structure for complex systems and decision-making is critical to a project like this. To that end, shortly after implementing the care management software, we created a governance structure for the providers using the platform. The governance structure had 2 groups, a system administrator group and a leadership decision-making body. The system administrator group met weekly and as needed to review system defects and enhancement requests. The system admin group also met weekly with the vendor to review those issues. Once defects were verified and enhancement requests vetted, the system admins would present the information to leadership for consultation and decision-making. In turn, a combination of leadership and system administrators met with the software vendor weekly to process the decisions and prioritize requests. In summary, the vendor selection process and management of this project was challenging but successful despite the complexity and ever-changing nature of the requirements. I believe the success was due to the structure that was put into place and the tremendous amount of collaboration between partners and provider organizations.